Hey, it's Jesse Dice with Blue Ridge Behavioral Health and Virginia Family Therapy. And for the second video post, I'm going to talk a little bit more about myself and not just what I'm hoping to use this platform for. I grew up in Massachusetts, and fast forward a little bit to the age of 16 is when I was diagnosed with OCD and started receiving treatment for that, and was getting really interested in what makes people tick, and more so than just a research interest, wanting to understand how healing relationships work. I went on to get my bachelor's in psychology and sociology, and then quickly went for my master's in clinical social work. I developed a strong interest and strong practice in serving those dealing with grief-related issues, anxiety-related issues, and later on in my career, folks who are intersecting with medicine, working with severe illness, chronic diseases, and a lot of the anxiety that goes along with that. I do have a fairly varied experience clinically. I have experience and started out with actually the homeless population in northwestern DC. Really just kind of on the front lines, working with a women's homeless clinic, which was extraordinarily moving for me. I went from there to working with sexually aggressive youth, and the majority of my, with the sexually aggressive youth, I was doing individual therapy in a residential school setting. And then from there, I went into medical social work, and I started working again with a lot of people intersecting with medicine, and wound up doing a lot of therapy with oncology patients and their caregivers. And now that I'm in private practice, I do carry a lot of those experiences with me in my interests, and continue to serve folks intersecting with medicine, illness, grief, loss, anxiety, OCD. And so you'll see in my posts that I will speak to a lot of those experiences and a lot of topics that are centered around those things. But I will also kind of go into other very broad strokes in therapy, and you will likely see a lot of me talking about acceptance and commitment therapy, which is something that is, I think, my umbrella philosophy for how I practice therapy and how I talk about mental health. So I look forward to continuing the conversation and getting to know everybody.